Right now, though, we're taking you live to Brisbane. We're seeing the Queensland Premier Anastasia Palaszczuk. She's there alongside her Health Minister, Yvette D'Arth, who's just finished speaking. Now we're listening to the Queensland Chief Health Officer. Let's listen in. He's giving a COVID update.
Subvariance is now well established in Queensland. Hospitals are feeling the strain with over 700 COVID inpatients across the public and private sector. And in addition to that, there's another 100 plus influenza patients in our public hospitals as well. The number of public hospital COVID inpatients has risen by 140% over the last month. And this is due to the BA4 and 5 subvariants, which are now dominant in Queensland. I'm afraid current modelling indicates that the wave is going to get worse at least until the end of July, if not even after that. So the peak of the current wave is currently projected, based on our most recent modelling, to continue to get worse until at least until the end of July or early August, when it will peak, or even later than that. So that will put even greater pressure on our hospitals in the coming weeks. This subvariant can evade immunity, whether that be acquired through vaccination or natural infection. So there is a very good chance that either you or someone you know will be infected with this subvariant in the coming weeks. It's very likely that either you or someone you know close to you will be infected. It will be very common. So my message is, it's important for you to prepare now. So I'll say that again. It is important for you to prepare now. The good news is that up-to-date vaccination will protect you against severe disease and hospitalisation. Up-to-date vaccination will protect you against severe disease and hospitalisation. And if you're up-to-date, the illness that you will get with this virus is likely to be mild. But unfortunately, at this stage, people over the age of 65 who are most likely to be admitted with this disease in Queensland, only or just under 50% are up to date with their vaccinations, which is very disturbing. The vast majority of people currently in our hospitals with COVID-19 are over the age of 65 and are not up to date with their vaccination. So I'm concerned that this message is not getting through, that people over the age of 65 need to be up to date. So I implore you, there are two things you can do to prepare yourself today. Ask yourself, are you up to date with vaccination? So over the age of 65, that's 4 doses. If you're an adult under the age of 65, that's 3 doses. That may change based on ATAGI recommendations, and I know ATAGI is reviewing the guidelines today, and we're just waiting with interest to see whether they expand the recommendation for those 4th doses. The other thing that I think is not well understood, and the message has not got out as well as I would have liked, is that if you are over the age of 65 and you have other medical conditions, you may well be eligible to get one of the 2 medicines which are currently available to treat COVID-19, and we know they risk your chance of being admitted to hospital. So we ask, I would strongly suggest that if you are over the age of 65 and you have medical conditions, you work out now, in advance, before you get COVID-19, whether you will be eligible to get these new medications, which are widely available now in Queensland. They're easily available, there's good supplies. Work out in advance whether you will be eligible when they come. And there are some complex criteria over the age of 65 and other medical conditions. Now, we will not be implementing public health mandates, such as mandating mask wearing, but older people and the immunosuppressed should seriously consider wearing a mask in crowded public places at least until the end of August, because we believe this wave will continue at least until then. Thank you very much.